everyone. Welcome to another episode of the Anti-Pharmacist podcast. As usual, I welcome you to a new week and I hope that you had a nice weekend with friends and family or by yourself as you like it, okay? Today, I'll be talking about a topic that is not strange, okay? But has to do with your medications as usual. So I know that a lot of people are fasting this period, and especially those that are doing the Ramadan fasting, yeah. And some of these people are taking medications, right? Especially for those taking them for chronic conditions, and there might be a kind of worry about how to go about taking their medications. During fasting, will my medications work, or should I just leave them all together and wait till after fasting? That is what I am addressing today, which is why my topic on today's episode of the podcast is dosing during fasting. Yeah, that's what I'm talking about. I will be enlightening you on how to go about taking your medications either for chronic or acute conditions during the fasting period. During the Ramadan fasting, it is expected that those observing the fast only eat before the sun comes up, which is called the sahur or sari by some people, and after sunset, which is called the iftar, right? So a lot of people will be taking medications for conditions like diabetes, for high blood pressure. Some will be taking some anticoagulants, and they'll be wondering, how do I go about taking my medication this period? That is what I'm addressing. So not to worry, you will gain clarity by the end of this episode. Without further ado, let's get right into it. During Ramadan, Muslims on long-term medication who want to fast may need to have their medicine dosage adjusted, okay, by their healthcare provider, the doctor, the pharmacist, as the case may be. You have to know that there are certain physiological changes that happen to the body during fasting. Number one is reduced immunity. You are immunocompromised, or your immunity is reduced during this period. Your body might not be able to fight off infections as it does during the normal months. Another thing is stamina. You won't have much stamina. So things that your body would resist, maybe through strength, you may not be able to resist them. Your stomach lining is thinner. It's more exposed because there's no food there. You understand? You are more susceptible to infections. All of these are the things that happen to you during fasting, which is why you make sure that you break your fast with nutritious meal. I believe that even in the religious aspect, that has been taken care of. They emphasize it. Eat good meals, eat fruits, eat fibers, to break your fast and all of this. I know that for Ramadan there are some rules and there are exceptions, all right? For the chronically ill that cannot fast, it is not made compulsory, yeah? And I'm sure that they have been taught, those that are exempted, like the pregnant women, the breastfeeding mothers, the women who are menstruating, and their ordinances for how they can make up for their fasting for these people. Even the elderly, those that are advanced in age to a particular point may be exempted. But for those who are chronically ill and believe that they can still go through with the fasting, it is encouraged. And for this set of people treating chronic conditions, they still have to take their medications during this fasting. During the course of research for this episode, I found out that they are not to eat, drink, engage in sexual intercourse during the fasting, okay? So drinking of water periodically may not apply to these people. I talked about kidney health on the last episode, which was on Friday, and I made mention of why hydrating is important, sipping water throughout the day, even if you're fasting. I guess for this set of people, they can't do that because of this religious obligation, but it is advised that they should take water when they're having their sahur or when they're having their iftar, and they should break their fast with fruits that have a lot of water content. I mentioned that. Yeah, but for taking medications, the good news is most chronic conditions, right, the dosage of the medication is usually 12 hourly or daily. For some, the likes of antihypertensives, antidiabetics, anticoagulants, antihyperlipidemics, they are majorly taken daily, except in very critical conditions. Do you understand? In which the parameters are so high that the frequency of the dosing has to be increased in order to meet the therapeutic goal. Most of them are usually once or twice daily. So if your medication, for example, is to be taken once daily, every 24 hours, you're still covered. You understand? You just have to take it when you're breaking your fast. Either you take it in the morning when you're having your sahur, or at night when you're taking your iftar. Yeah. And for daily, you can do that as well. For twice daily, you do both in the morning and at night. But for people that take the medications with frequency more than twice a day, that is every 8 hours, every 6 hours, or every 4 hours, as the case may be, you would have to talk to your healthcare provider, speak to your pharmacist about dose adjustment, or to your doctor. All right, we are going to the Ramadan period now. How do I adjust my dosage, the dosing of my medication, seeing that I take this medication 4 times daily? They may advise you on how to take such that you take loading dose per time. You understand? Instead of taking maybe 500 milligrams of a drug every 6 hours, you might have to take 1 gram every 12 hours. You understand? I'm not saying it's general rule, but I'm just citing that as an example of dose adjustments that can be made. Other times they might switch you from your normal medication to one with more convenient dosage. Okay, maybe you were taking one that you take twice daily and it's still not convenient for you. You don't eat much in the mornings, you eat the bulky meals at night, and you just want to take it once daily. Or when you take it in that morning, you feel somehow it's affecting you because of the fasting. They might shift to a different medication. They might switch you to a different medication with lesser side effect because of your fasting, or with a more appropriate and convenient dosage. I hope you get me. Yeah. And it has been noticed through research and studies that during fasting, some conditions actually abate. Let me put it that way. Like they change. Okay. For example, for those that have diabetes, studies have shown that blood sugar levels of patients during Ramadan tend to be lower, which is understandable. You're not eating as much as you do on the other months. So at this period, the regular dose of diabetes medication during the fasting month may be too much. So dose adjustment may be necessary, so that you don't suffer from hypoglycemia, which is low blood sugar. Also, it has been noticed that for blood thinning medicines, the likes of warfarin, your heparin, during Ramadan, there are fluctuations in blood thickness in patients. This could have been caused by the dietary and lifestyle changes during this period. So when patients take the likes of warfarin, the effect of the medication can also be affected by vitamin K intake, which is found in green vegetables, leafy vegetables, or even some other food ingredients like mayonnaise. It is important for this patient to maintain their blood thickness within the specified range, so that it's not too thick or too thin. And this can only be done by working hand in hand with their healthcare providers. So they might have to adjust the doses of their medication. Now, I'm not talking about the time in which they take, even the amount or the strength they take during fasting. You might have to adjust them. So if you're on any medication, talk to your healthcare provider during Ramadan fasting. Oh, doctor, pharmacist, I'm going to Ramadan fasting. Oh, these are the medications I take. Is there any that I have to reduce because of the fasting? Even, I mentioned earlier, it could be due to side effect that you would experience during this period, or so that they don't overwork because of your empty stomach, in quotes. Do you understand? Also, those that take medications for acute conditions are not exempted. You might want to fast, yes, but what if you come down with a condition that requires you to take medications that have more frequent dosing than twice daily or once daily? What do you do? I believe that in this case you should treat that condition. All right, maybe you have a sudden bout of a bacterial infection, you are coughing violently, you have taken your syrups twice daily and they are not working. You've been given a medication which you have to take every 8 hours for 5 days. You should take that medication. Don't say because I'm fasting I can only take it twice daily, not 3 times daily as prescribed. Tell your healthcare provider first that, I'm fasting. If it can be done such that a drug that you can take twice daily can do the same work, they might do that for you. But if this is the best medication for this condition and it is to be taken 3 times daily, please do not hesitate. Treat yourself for those 5 days, for those 3 days, for that 1 week, and after you can continue your fasting and make it up later. I've said that there are rules and exceptions to this thing. God is not wicked. He knows that things may come up that would disrupt this religious activity or exercise. So he has given some allowances. You can educate yourself on that. You can meet your religious leaders to explain to you while working hand in hand with your healthcare provider. But please don't, because you're fasting, neglect your health. But all in all, what I'm saying is during Ramadan, take more care with your medications. Be more intentional. Work hand in hand with your healthcare provider. Do not keep them in the dark, and do not just assume that, I'm fasting, I will stop this medication. That might just be a very dangerous decision for you. It might lead to the loss of your life. And do not say, hey, I'm a strong person, I'll continue taking my medication as I have been taking it since we're in Ramadan. It doesn't matter. Please, it matters. Note your doses during Ramadan and before or after Ramadan. They should not be the same for majority of the conditions, except otherwise advised by your healthcare provider. All right. Also, you may experience weight loss during fasting. So for drugs that are given based on weight, you would definitely need dose adjustment. Do you understand? So do not stay in your house during fasting and say, I've been prescribed this medication and I've been told to take it, let me just continue. Work hand in hand with your healthcare provider during fasting. Well, that is for oral medications. For non-oral medications, the likes of eye drops, ear drops, suppositories, injections, there is no reason why you should not take those during fasting. At least you're not taking them orally. You're not passing them through your mouth. All right. So that is basically it on today's episode. Okay. The summary is that during fasting period like Ramadan, work hand in hand with your healthcare provider to adjust your drug dosages. Do not, because you are fasting, abstain from taking your medications, or just continue taking it as usual, because in the long run you might have therapeutic failure, complicate your condition, or it may even be fatal if care is not taken. All right, and that is it on today's episode. Thank you for listening up to this point. As always, I would plead with you to keep helping this podcast grow by listening, by following, subscribing, by sharing the podcast, and leaving your comments in the comment section. I love feedback, guys. I've said this time and time again. How do I know if I'm doing the right thing? How do I know if you're gaining knowledge from this if you're not telling me? Leave your comments. If you have a comment, if you've experienced something that has to do with the topic that I'm discussing, please let me know in the comment section. I would love to interact with you. If you have questions, send to me via mail at efficacy.This@gmail.com. It's open for you to send your suggestions, your comments, your questions. Also, you can send to me via DM on my social media, on WhatsApp. I have a WhatsApp channel now, so please, if you're amongst my contacts and you have seen my post on this channel, please join the channel. Okay, I'll be sharing health insights. I'll be sharing the topics on this podcast as they come out. All right, please follow me on Facebook, on Instagram, on TikTok as Anti-Pharmacist Podcast. That is the name of the page. All right. On X, I'm Fan Podcaster. I have a page on LinkedIn. It's my personal page, but I use it to share the content of the podcast as well. That is Bemisola Adebisi Jose. Contact me, okay? Connect with me. If you are a fellow podcaster, a content creator, and you think that we can work together, please do not hesitate to reach out. I love collaborations. I love feedback. I love following, Please just help this podcast. And on YouTube, guys, subscribe to my YouTube channel. It is when you have helped me grow that to a considerable extent that I would consider turning this into video podcasts, okay? Because a lot of things, a lot of effort go into all of this. I must tell you for a fact that this is a passion project for me. It's not because of money or anything. I'm doing this just so that people can be aware of things that they should know. And misinformation is killing a lot of people out there today. Who else should educate you if not an experienced and well-researched professional like myself? So I am offering you the knowledge that I have on drugs, on health. Please avail yourself of this information and this opportunity. And do not hesitate to share to your friends, to your family as well. A little information could save lives, not just one. And a little misinformation could take lives as well. Please and please help this podcast to grow. I appreciate those that have been following, have been subscribing, have been listening, have been leaving their comments, likes, and reviews up to this point. Thank you so much. You have given the podcast some amount of visibility, but I need more. This podcast has to go worldwide. All right, I've reached about 15 countries, but I just don't want to reach them like that. I want to make impact in these countries. I want to have a large listenership. I want Anti-Pharmacist Podcast to be a household name when it comes to health information, when it comes to information about your medications and your health. And I know that you guys can help me get there through your support. So once again, I'm soliciting for it. Thank you so much. Thank you. As you decide to help this podcast to grow, God bless you. Till next time, stay healthy. And as usual, I will say it again, God bless you. Have a nice week.